What is up, everybody? This is Dr. Andrew Kim M.D. I'm a board certified psychiatrist, and today's video is on bright light therapy for seasonal depression, sometimes known as light box therapy for seasonal depression. For those of you who are not familiar, bright light therapy is an attempt to mimic natural daylight or sunlight as a legitimate intervention to treat seasonal depression. First off, seasonal affective disorder implies that you have a form of a mood disorder, such as mania, hypomania, depression, that has a seasonal pattern of onset and remission. I think most of us, and for the sake of today's video, are most familiar with, and we're going to talk specifically about the subtype of seasonal affective disorder that is the subtype of depression that happens with the fall winter onset when natural daylight or sunlight diminishes per day. Now, some people actually have the other type where their seasonal depression starts in the spring and summer and actually gets better in the winter months. But today, we're going to be talking about bright light therapy specifically for the fall winter onset subtype with depression. Okay. So, first of all, I want to just say anecdotally, I recommend this treatment quite a bit to patients of mine who have seasonal depression. Now, I see several mistakes occurring, so I try to provide education so that people will avoid the mistakes of buying the wrong type of light box, doing the wrong type of positioning of the light, not doing exposure for long enough, and answering their questions about when to start it in the season and when to stop it. So those are some of the principles we're going to go over today. If you could just stick around for a few minutes, okay? First of all, is there any legitimate evidence that bright light therapy or light box therapy can work for this subtype of seasonal depression? And the answer is yes. There are numerous randomized clinical trials, even some recent meta analyses, even within the last few years, that have demonstrated that a large portion of patients with seasonal affective disorder with depression can benefit from this very benign intervention. Some recent studies even suggest that over 50% of patients with seasonal depression will get a very positive response or even remission. What does that term mean? Positive response? In the field of psychiatric research, a positive response is defined as a greater than 50% reduction in the severity of depression. Not bad, in my opinion, for something as lowly invasive or benign as mimicking daylight. Okay. Now, were there any characteristics of those who responded well? Were there any features that might help be predictors of a good response? There were a couple correlations. So, again, keywords correlation. One was having the feature of hypersomnia with your seasonal depression, sleeping too much, having a hard time getting up in the mornings. Another feature was increased appetite, especially carbohydrate cravings. So, those were a couple of the predictive factors. So, let's get into the nitty gritty of some of the important principles if you are considering embarking on bright light therapy intervention. And to preface this, to keep this simple, I am not your personal physician. I'm not telling you how to conduct your healthcare. This is for educational purposes only. Please talk to your own healthcare provider about doing this before you start to see if it's an appropriate intervention for you. Please. Principle number one, please make sure that you are looking into appropriate lamps or light boxes. Sadly, I'm going to tell you this right now to spare you some grief. Most of the affordable light boxes out there on the internet are not going to work. One of the reasons why is you need one of these lamps or light boxes to produce 10,000, again, 10,000 lux, L-U-X. Now, some of you are Googling right now and you're going to say, well, I find plenty of them. It says 10,000 lux for seasonal depression, $19.99, $15. Now, the next thing I need you to do is not just pay attention to the 10,000 lux, it's at what distance will it be able to produce and mimic 10,000 lux. Most of them in the fine print are going to say, oh, 10,000 lux at 2 inches. Is this practical for you to do every morning? And then it'll say, oh, at 2 feet, it's going to be 1,000 lux. And why is that important? To get the best chance of effectiveness. Most of these studies show that you need about 10,000 lux for about 30 minutes of exposure in the morning. In order to replicate that with, let's say, 2,500 lux, you might need to do that for 2 hours. And will that translate to being practical? Probably not. Okay. So it's important to find the right kind of lamp that can emit 10,000 lux at a reasonable distance. And really good light boxes can still produce that even about 1.5 feet away or even up to 3 feet away from the light source, which makes it much more practical. Another thing that's important is to find one that filters out UV or ultraviolet light to reduce damage and for the sake of the safety of your eyes. Okay. Principle number two, where to position the light once you've purchased it. Um, I know this sounds very obvious, but I have patients who have done this. You need the light source within your field of vision to be able to see the light. Some of my patients have put it behind them, off to the side in the corner where they can't even see the light. It brightens the room, but they're actually not looking at it. And you need your eyes to detect the light to fool your body into thinking you're being exposed to sunlight and daylight. So make sure that the light is positioned within your field of vision. Don't put it where you're gazing directly at it to strain your eyes. Somewhere within your field of vision, within the periphery. Typically, we recommend doing it above your head, angled downwards at like a 45-degree angle to mimic sunlight. Okay. Principle number three, what time of day should I do this and for how long? Okay. We typically recommend doing morning exposure, uh, preferably within the first 30 minutes of waking up. They actually have looked into this. They've looked at and compared morning sessions versus morning versus evening plus morning combined, morning sessions versus evenings alone, and they consistently find that the best results happen with a morning exposure of bright light therapy. Okay. There is even some evidence that doing this too late in the day, not for all, but for some individuals, may actually worsen the mood or even sometimes risk insomnia. So, morning exposures for about a 30-minute session. Some studies did examine 45 or 60, but I would start with about 30 minutes. And then, in terms of a treatment course, most studies considered about 3 to 4 weeks of daily morning exposure as kind of a treatment course where you can expect pretty good results. And then to maintain that routine over the course of the winter, all right? In terms of timing of seasonality, they generally recommend starting maybe 2 to 4 weeks prior to when you know that your seasonal depression kicks in, and then stopping 2 weeks after spring has come and daylight is back to normal, or if you kind of know when your seasonal depression tends to end, you're feeling good, you're kind of around the time where that seasonal depression ends for you, to go about 2 weeks past that time point as well before stopping. You don't necessarily have to taper and lower the increments, you could just stop. But if you're feeling good and you're getting closer to that endpoint, some people choose to taper for the sake of convenience. And instead of doing the 30 minutes per morning, maybe doing 20 minutes at a time to just make it a little bit more convenient as you're getting closer to the end when winter is wrapping up. Okay. Finally, in terms of safety and side effects, from a safety standpoint, I already gave you the disclaimer, go talk to your clinicians, but in particular, for those of you who have any history of ophthalmological issues in your eyes or any health conditions that affect the health of your retina, I would say in particular, in those situations, talk to your ophthalmologist, talk to your doctor. If you are on prescription meds that make you more photosensitive and makes you or your skin, etc., more sensitive to light, um, talk to them as well. Like meds such as lithium, tricyclic antidepressants, hydrochlorothiazide can do these things. So have a discussion with them. In terms of common side effects, though, common side effects, the most common ones are going to be eye strain, headaches, insomnia. If you're noticing eye strain and headaches, consider the positioning of your light. Are you looking too directly into it? Is there any way to reposition it, maybe a little bit further? And for the insomnia, are you doing it too late in the day? Okay. Now, for those of you who say these generic instructions are overly broad, I want to customize more specifically to me and know precisely what time. There's no such thing as exact precision, but there are some surveys that are research-based surveys out there. One of them that is kind of a public domain survey that you can go look up is called the Morning Eveningness Questionnaire. The Morning Eveningness Questionnaire. And if you fill this out, it's trying to ascertain, are you a night owl? Are you a morning person? What time of day is optimal for you? And by doing this, this is a research-based survey. It's not a standard of care kind of thing, but it's a research-based survey that tries to estimate a more precise time in the morning for you to do the bright light therapy rather than following kind of this generic do it within the first 30 minutes of waking up kind of deal. Okay. So, in summary, bright light therapy or light box therapy is an evidence based intervention that can help folks with seasonal depression, specifically that fall winter subtype, fall winter onset. That's where it's probably going to have the most robust evidence for. It's probably underutilized, not talked about enough. And that's sad because this is a very, like I said, low risk intervention. To me, part of the reason it's not utilized as often is cost and accessibility. Unfortunately, like I said, most of the better light boxes that make this convenient to do with your morning routine, so you're not glued to the lamp and have it at a comfortable distance, they're going to run roughly 100 to maybe 300 something dollars. So not super cheap, unfortunately. Okay. But again, legitimate intervention. And I think it's important to highlight these things so that you could be advocates for yourself because we need to approach our wellness and our mental health and our psychological health with a holistic approach. Why wouldn't we utilize this if you can't afford one of these to attempt this if you're struggling with seasonal depression? So, for those of you out there who have ever used this, who have ever heard about it, I'd just like to hear what are your results? Have you seen for yourself personally? This was crap, didn't really do a thing, or I've actually noticed a big difference. I would be very fascinated, especially for those of you living in these cold, cold weather states or countries where winters are harsh and daylight is short in the winter months. So if you found this very interesting, please like, please subscribe. This is Dr. Andrew Kim. Thank you again for joining. And for my longtime supporters, thank you so much for continuing to watch my channel and my videos. Stay tuned for more interesting content like this. Have a safe winter, guys.